Today marks 60 years since President Lyndon Johnson signed Medicare and Medicaid into law. This anniversary comes just weeks after major changes and cuts to both programs were passed by Congress. The idea for a national health insurance dates back to President Franklin Roosevelt's New Deal programs. His advisor considered adding a nationalized health care plan to the newly created Social Security system. In the 40s, President Harry Truman revived the idea and wanted to expand it to include universal sick pay. However, medical lobbyists spent millions of dollars to negatively brand the idea as, quote, socialized medicine and killed the effort. In the decade afterward, private insurance provided by employers became the primary health care coverage system. Then in 1965, Medicare and Medicaid were signed into law to fill in some of the gaps for those who weren't covered by private insurance. Medicare was designed for those 65 and older, while Medicaid provided insurance to low-income families and people with disabilities. Both programs have since expanded significantly. Medicare started out with just hospital and medical insurance, but now there is also prescription drug coverage and an option to pay for expanded care like dental and vision. And after the passage of the Affordable Care Act in 2010, Medicaid expanded to cover single low-income adults. Now, according to the Centers for Medicare and Medicaid, 72 million Americans have Medicaid insurance as of April, and 69 million Americans over the age of 65 have Medicare, or 90% of all those in that age group as of March. The Congressional Budget Office estimated that the changes recently passed by Congress to Medicare and Medicaid would lead to more than 10 million people losing their insurance over the next decade. That includes Medicaid implementing a mandatory work requirement and new limits on who can qualify for Medicare.